my role, I had access to the at-risk register, and I'm just wondering if the health board have that sort of system in place in terms of patients and the risks that they present to staff.
Sadly, as you know, we work in silo, don't we? And I noticed Paul used that word as well, silo, and there's too much of it within the NHS. A lot of people think that the NHS is one large organisation, whereas we all know it's not. It's broken down into many different provider and commissioning organisations. We have started to try and collaborate, but there is no specific national register that we can get access to, and very often people don't share the problems that they've had between health and social care. That's a very common problem that we get, but it is something that's being worked upon.
Yeah, and it's just a question of whether we need the oversight of patient information and whether that information can be pulled to facilities, specifically to porters as well, because we're having that one-to-one, dialogue and care and support for individuals as well.
I mean, obviously there are a number of different patient records, but you've got things like System 1, if you've heard of that, and Rio, which people use for mental health. They do have risk pages on them on which you can put incidents, and obviously if people are dealing with patients, they should read those first before they go on to a ward and perhaps have them on level 1 OBS, which is probably which is within arm's length, etc. But there is that gap, if you like, between hospital patients and staff that go out into the community. But it certainly is something that we're picking up when we talk to system providers to say that we need to have this system whereby if somebody is a threat to a member of staff, and there are some real horror stories with this, then we need to make sure that that happens, but not as good as it should be at the moment, unfortunately.
No, and we had a system called WCCIS, and I helped roll that out, and this pulled that information to ensure that I had oversight of patient information and the risks. So it'd be interesting to see what's coming.
Obviously, you've got to look at GDPR, DPA, so you've got to make sure that the information is still current, that it's accurate, etc. And you need to have some system to weed that information out. But no, not as good as it should be at the moment, I'm afraid.